Welcome to the fifth module of our educational program, and this is by myself, Samantha Dittmer, and Brittany Hartman.
Last session, I went over toddler feeding. I went over that positioning during feeding is key. It's important that your toddler is comfortable with their hips, knees, and ankles at 90-degree angles. There are various feeding strategies to use as your child grows, such as providing small portions when introducing solid foods. Begin finger feeding with foods that easily melt in your child's mouth. Introduce utensils as play objects before you begin spoon feeding, and open cups, straw cups, and cups with flat lids are best for toddler cup drinking. I discussed that a picky eater is when a child eats a limited variety of foods and is unwilling to try new foods. To try and break your child of being a picky eater, you can make food fun, explore new foods through play, increase your child's awareness to their mouth and tongue, and much more.
So in our last module, I talked about postpartum anxiety and postpartum OCD, and we learned that postpartum anxiety affects 10 to 18% of new mothers, and OCD can affect 3 to 5% of new mothers. We also learned that family history and personal history of mood disorder is a big risk factor. We learned that OCD is comprised of those obsessions and compulsions. So for example, obsessions being worried about germs on the floor and the baby putting their hand in their mouth, and the compulsion would be repetitively cleaning that floor over and over again. And then we also learned that honesty is key for correct diagnosis. So when you go to a medical professional, being honest about the symptoms that you're experiencing will help them diagnose you correctly and get you on the right path for treatment. In this module, I'm going to be talking about birth trauma and PTSD. So I wanted to start by going over some basic definitions that I will be talking about during this module. So first we'll discuss birth trauma, and that is distress experienced by the mother during or after childbirth. Trauma can be physical, such as a birth injury, but it's often psychological and emotional for the mother. And then PTSD is defined as a psychological reaction occurring after experiencing a highly stressing event, such as wartime combat, physical violence, or a natural disaster. And in this case, it would be the birth trauma. And that is usually characterized by depression, anxiety, flashbacks, recurrent nightmares, and avoidance of reminders of the event. So being withdrawn, avoidant of things that would make you think of the trauma that you experienced. So when I speak about birth trauma, what is birth trauma exactly? So it can be when a woman feels threatened during her birth experience, or maybe feels a serious fear for her safety. A woman may also feel trauma when her birth experience didn't fulfill her vision, or maybe go the way she expected or play out as she imagined it to. Birth trauma may also be experienced when there are unexpected complications, such as an emergency C-section, birth trauma with the baby, maybe something medically not going the way she wanted it to go. This can all relate to having birth trauma. So what are some events that could contribute to the cause of birth trauma? This is obviously not an all-inclusive list, and every woman's childbirth experience is different. It's also important to keep in mind that what one woman might perceive as traumatic, another woman may not. So it is all very unique, and it is based on the perception of the woman's experience. So some things that could cause birth trauma is the use of forceps or other equipment during delivery, having a premature labor or delivery, a significant amount of blood loss or a hemorrhage, pregnancy loss, the baby having complications or needing admitted to the NICU, and maybe having an unplanned or an emergency C-section. So now let's talk about postpartum PTSD a little bit more. So the criteria for being diagnosed for general PTSD is the same for postpartum PTSD. The difference with postpartum PTSD is that it's usually due to a traumatic event during the perinatal period, so maybe during pregnancy or the childbirth itself. And although if someone has been diagnosed before, it can be triggered again by childbirth or the pregnancy process. So we will talk about another risk factor for developing PTSD, and this could be prior PTSD due to a different experience. So it is important to remember again that PTSD stems from a person's reaction to an event, not just the event itself. So everyone processes experiences differently. So what might be traumatic to one person may not be traumatic to another. And like I said before, this PTSD can be reoccurring or it can be due to trauma in the pregnancy or the birth. So the birth trauma can trigger the PTSD, but if someone had prior mental health diagnoses, it obviously will increase their chances of developing this postpartum PTSD, which could develop the same symptoms as somebody who experienced the trauma just during their childbirth. So how common is postpartum PTSD? So 0 to 35% of women have PTSD during pregnancy. 0 to 21% of women will have postpartum PTSD specifically. And then the diagnosis of PTSD will usually come between 1 to 6 months postpartum as those symptoms become more prevalent and they increase. So this would be around the time where somebody would notice that what they're experiencing isn't just maybe the baby blues that we talked about previously. It is something that will continue to get worse. And this is when a lot of people who do seek help will go out and seek that help during this time. So what are some symptoms of PTSD? I think it is helpful to think of PTSD symptoms in clusters. So within those clusters, we see multiple symptoms. The diagnosis of PTSD can be made after 1 month or more of experiencing these symptoms according to the diagnostic manual that professionals use to diagnose different uh, illnesses and diagnoses. And this is not an all-inclusive list. And like I said, everyone is unique in how they experience PTSD. But we will think of the symptoms here in those three clusters that I talked about. So here we have intrusion, avoidance and numbing, and also hyperarousal. So within intrusion, we like to think of nightmares, flashbacks, and recollections. So having those vivid reminders of the event over and over again. And then we have in avoidance and numbing, we have avoiding the feelings or conversation about the event, isolation or withdrawal, and then decreased affect, so having difficulty showing emotion. And a lot of people might describe this feeling as feeling numb. And then we have hyperarousal. So in that cluster, we like to think about insomnia, anxiety, and then irritability, or just having trouble shutting off. So what are the risk factors, or what makes you more likely to experience postpartum PTSD? A study found some risk factors that were significant. Those include social isolation or divorce, having a history of abortion or infertility, having a long labor, and this can be subjective. What one person might say is a long labor may not be a long labor to somebody else. Having obstetric complications, needing surgical practices done, having high anxiety during your labor, your delivery, or your hospital stay is also a risk factor. The highest risk factors that the study found were an individual's experience with childbirth, social isolation, personality disorder, and high stress and anxiety after childbirth. I will talk more about the importance of having peer and social support in later modules, but we can start to see a trend here with individuals who have low social support and their risk for mental illness after birth. So here is a video of a woman who is describing her experience with having postpartum PTSD due to having birth trauma. So what can we do before or during birth? So if this doesn't apply to your current stage of life, I just like to discuss it just in case you have a friend or maybe a family member, or maybe if you are planning on having another child in the future, just some things that might be able to help you prevent the significance of those postpartum PTSD symptoms if you begin to develop them. I think education is super important, and just being aware of what could happen could definitely help you be more prepared. So, educating yourself on the risks of pregnancy, labor, and delivery can be very helpful for expecting moms. So knowing what could happen could help you mentally prepare you for the experiences you may, but hopefully do not have. Studies show that those with lower social support had increased PTSD symptoms. And those who had a birth partner or a midwife present increased maternal satisfaction. And as we know, this is important because maternal satisfaction of the labor and delivery process, and even just the whole pregnancy experience itself, was a big factor in the development of PTSD or their perceptions on the birth. And we learned that perceptions on the birth could one person describe as birth trauma and another one would not. So we basically just want to make your perception of your pregnancy and your birth experience as best as we possibly can. And having these supports in place could help you look back and be happy with your experience. So what can we do after birth or with the diagnosis of postpartum PTSD? First, you can try talking about how you feel. Studies show that those who did not express their feelings had more severe PTSD symptoms. You can also try to talk to family, friends, or to a professional, whatever helps you get those experiences and those feelings out. Sometimes I like to suggest writing on paper as the first step. That can be kind of like a baby step towards talking about your feelings to another person. So just keeping a daily journal could help you a lot. Next would be to monitor your symptoms. Be aware of if your symptoms are increasing or if you're developing new or worsening symptoms. And then we want to try cognitive reappraisal. So a study showed that something like cognitive reappraisal can be helpful. So an example of this is thinking of a situation in a more positive light. So for example, a mother may feel that her body has failed her or have low self-esteem after having to have an emergency C-section, or maybe her birth didn't go the way that she wanted it to go. Doing cognitive reappraisal would be telling herself that her baby is healthy and that she's brave for going through that experience, and that might help her perceive her birth differently. And then obviously, we want to talk to your doctor about different treatment options. If you need help finding someone local in the area, try talking to any of your early intervention therapists. Let them know that you're looking for a doctor that could help you receive specific and unique help for your situation. So we're going to do a little knowledge check from today's module. So how a mother thinks about or views her birth and postpartum experience is an important component of trauma and PTSD. A, true, or B, false. So the answer to this would be true. So as I discussed previously, we know that the way a mother perceives her pregnancy and birth and postpartum experience is an important component to the development of PTSD.
This week, my topic is on infant and child hunger cues. By the end of this session, I hope you'll be able to identify signs of hunger for a baby and toddler. I hope that you'll identify signs of fullness for a baby and toddler. I hope you'll be able to define responsive feeding. And I hope you'll be able to list responsive feeding strategies. So, how do you tell the signs that your baby is hungry? You want to watch for the signs on this slide, they tell you that your baby is hungry and then you want to feed your baby as soon as possible. So the first sign is their fists will move towards their mouth. Their head will turn to look for the breast or bottle. They'll become more alert and more active. They'll start sucking on their hands or they'll begin lip smacking and they'll open and close their mouth. So, does crying always mean hungry? Many parents think crying is the only sign that their baby is hungry, but it's actually a sign of distress. Hungry babies will show signs of hunger before they begin to cry. So, watching for and responding early to your baby's hunger signs may help prevent them from crying. Once a baby is crying, it can be harder to get them to latch to the bottle or breast. So, how to identify signs that your baby is full? It's important to let your baby nurse until they're full, and some signs that babies are done eating are that baby releases or falls off your breast or bottle. Baby will turn their head away from your nipple. Baby relaxes their body and opens their fists. And if your baby finishes eating on one breast and seems full, try burping your baby or changing their diaper if needed. Then offer the other breast. If your baby doesn't seem interested or doesn't want to latch, they may not be hungry anymore. Some babies may eat from both sides at every feeding, while others may only eat from one side. Moving on to toddler hunger cues. So as your child gets older, he or she will develop new signs for hunger and fullness. Understanding your child's signs is important to help you know when and how often to feed your child. Listed on this slide are the signs your child may start to show between 6 to 23 months old. So your child may be hungry if he or she reaches for or points to food, opens his or her mouth when offered a spoon of food, gets excited when he or she sees food, and uses hand motions or makes sounds to let you know he or she is hungry. So how to tell that your toddler is full? So your child may be full if he or she pushes food away, closes his or her mouth when food is offered, turns his or her head away from food, uses hand motions or makes sounds to let you know he or she is full. You want to let your child decide how much he or she wants. Your child does not need to finish a bottle or all of the food in the jar or on the plate. Food is not a good reward or punishment. Talk to your child's doctor or OT if you're concerned about how much or how little he or she is eating. So how do you respond to your baby's or toddler's hunger cues? It's important to use a responsive feeding technique. Responsive feeding means you are recognizing and responding to your child's cues of hunger to support and maintain your child's natural capacity to self-regulate their energy intake and avoid overfeeding. It's so important to listen to and trust your child when it comes to feeding. There's a motto that goes along with responsive feeding that is, the parent provides, the child decides. So the parent can provide the food option and the child decides if they want to eat. If your child is hungry, they will eat. I wanted to go a little more in depth with responsive feeding, and I found this video that does a great job of explaining it. So how can you practice responsive feeding? First, make sure your child is comfortable during feeding and minimize distractions. Remember proper positioning and make sure there is no TV in the background. Keep an eye out for your child's signs of hunger, such as pointing at food you may be eating if they're hungry, or dropping food on the floor can be telling you they're full. Respond to their cues promptly. If your child is hungry and not responding in a timely manner may lead to them getting upset and crying. Or if your child is full and they turn their head when you offer a bite, let them be finished with that meal. Focus on having a positive attitude during feeding. Be warm, nurturing, and affectionate. Kids can pick up on if you're stressed, which could cause them to have a stress response during feeding as well. So here are some strategies for you to utilize at home to practice responsive feeding. First, accept food refusal. If your child is turning away or throwing food on the floor, they may not be hungry. Guide portion size by serving the right size portions. Parents often overestimate how much food a child should eat, especially with foods that aren't yet favorites. A couple of tablespoons is plenty to start with. Small portions are less overwhelming, while bigger portions may encourage overeating. Don't focus on the amount your child is eating. If your child chooses not to eat anything at all, simply offer food again at the next meal or snack time. Encourage independence by allowing them to self-feed and by accepting mess. Kids should start finger feeding around 9 months of age and try using a spoon around 18 months. Make sure you have a neutral response to your child accepting food and refusing food. If you are overly excited when they accept bites and seem overly pushy when they refuse, these types of responses could dull the internal cues that helps your child know when they've eaten enough or if they're still hungry. It's important to refrain from coercion, coaxing, and games to get your child to eat. You want your child to eat the spinach you serve, and your child drops it on the floor. Your well-meaning impulse may be to start talking up nutritious foods, saying how big and strong spinach will make your child. Or you might start bargaining. If you eat 3 more bites, I'll give you a cookie. The problem is that these tactics don't work long term. Who hasn't used the line about spinach making you strong? But this approach may build dislike for the healthy food rather than acceptance. Keep teaching kids about the benefits of healthy foods, but don't push too much by cheering every bite of spinach your toddler eats or disapproving when they refuse. It's just as important to not offer rewards, bribes, or alternatives. For some kids, dinner becomes a negotiation session from the very start, and parents have been using dessert as motivation for decades. But this doesn't encourage healthy eating. Instead, it creates the impression that treats are more valuable than mealtime food. Foods like candy and cookies are not essential to a child's diet. Threatening a punishment, much like bribing a child with dessert, won't work in the long run either. It creates a power struggle. Praise your child for tasting the food or for feeding themselves, but don't praise your child for eating. Encourage healthy eating by continuing to offer your child nutritious choices at every meal. It's also important not to use emotional feeding, such as distracting your child to take a bite, comforting them when they cry that they're finished, but continue to try to get them to eat. This shapes a negative behavior around eating. And lastly, it's so important to not have a distraction such as TV while eating, as the focus should be on the food, not the TV. So how do we use responsive feeding for picky eaters? Most toddlers are picky eaters. Many toddlers express their building independence through eating or not eating, as the case may be. So nearly all toddlers could be described as picky eaters. If kids don't like a food, they won't eat it. It's that simple. Does your toddler want to eat only macaroni and cheese? When a child is stuck on one food, a parent might feel forced to serve that food every day, so the child eats something. But eventually the child may tire of that food. So then what? You choose the foods on your toddler's plate, and you don't have to serve macaroni and cheese daily. If you do, you miss a chance to introduce new foods and increase the number of foods your child is willing to eat. Most of these food jags won't last long if parents don't give in to them. Kids won't starve, but they will learn to be more flexible rather than go hungry. Serve a variety of healthy foods, including known favorites and some new foods, to make up the menu. Your toddler may surprise you one day by eating all of them. Your toddler doesn't like green beans the first time around? Don't stop serving them. Kids are naturally slow to accept new tastes and textures, so keep reintroducing the beans. Serve a small portion and encourage your child to try a bite without nagging or forcing. And be sure you're setting a good example. Serve nutritious foods that you like or eat something new so your kids see you enjoying what you're asking them to eat. So why is responsive feeding so important? If you don't practice responsive feeding, it could lead to you overriding your baby's own internal hunger and fullness cues. Your child may develop unhealthy eating habits and be more likely to become overweight or obese later on in life. You may affect your baby's ability to self-regulate or control their eating and emotions. Feeding a baby takes practice, and it's normal to feel frustrated at times, but try to remember that it's important to create a positive feeding experience. Ignoring your baby's hunger or fullness cues or making mealtime stressful can lead to unhealthy habits. Remember, with responsive feeding, you provide and your child decides. This sets your baby up for healthy growth and development. So, a knowledge check question for you. Select one. What is the best way to respond to your child's hunger cues? Is it A, play games to get your child to eat? B, encourage your child to finish the entire plate of food you presented? C, accept food refusal? Or D, bribe your child with dessert? The answer is C, accept food refusal. You can always feed them the same foods next meal and try again and again until they eat that food, or until you realize that, hey, they don't like this food because I've put it in front of them 20 times and they're still not eating it. So then you move on to try something else. I have a resource on responsive feeding, and I'll provide the link in the section below.